Good evening, everyone. Hopefully everybody can hear me well. My name is Haley Thompson, and on behalf of Wayne State University and Carmano's Cancer Institute, welcome to this second part of our Community Engaged Research Symposium for 2022, focusing on over 3 nights, Black health and racial equity. So first, let me welcome you more fully. Please stay muted, okay, especially during the presentation. So try to stay muted. And also we're asking that you keep your cameras off during presentations. Thank you very much for that. Next, I'd like to do this land acknowledgement. Wayne State University rests on Wawayetanang, also referred to as Detroit, the ancestral and contemporary homeland of the Three Fires Confederacy. These sovereign lands were granted by the Ojibwe, Odawa, and Potawatomi and Wyandot nations in 1807 through the Treaty of Detroit. Wayne State University affirms Indigenous sovereignty and honors all tribes with a connection to Detroit. Okay. And then also I'd like to do, we welcome everyone. We're glad that all people are welcome here, and we are grateful for everyone's participation. We'd like to give also a particular welcome to our transgender, non-binary, and gender non-conforming participants. And we ask everyone to remember that a person's purposeful gender expression or external appearance may not match their internal gender identity. In this space, we are committed to not making assumptions about anyone's gender identity based on the way they look, sound, or behave. Please ask about pronouns. Some people have the pronouns next to their name in the little box in the Zoom, and please be aware of those. And if you're not, feel free to refer to people as they, them, or theirs. So thank you for listening. So I first want to just acknowledge the 2 entities that have made today possible. The first is Wayne State University's Checkup, the Center for Health Equity and Community Engagement. For Center for Health Equity and Community Knowledge in Urban Populations. We're thankful for the support of Wayne State University's Office of the Vice President of Research for supporting this new emerging center with the goal of developing infrastructure to accelerate community academic partnerships to address health inequities and to support research partnerships in this space.
Recording in progress.
And you'll see our website is there on the screen. I also want to acknowledge Carmano's Cancer Institute's Office of Cancer Health Equity and Community Engagement, which coordinates community outreach across half the state of Michigan around cancer prevention and control. And our website is there as well. So these are the 2 entities that have helped make today possible. And again, in case you haven't registered for Wednesday night and Thursday night, the continuation of this evening's activities, please do so. And then next week, we're going to be continuing on with our MENA, Middle Eastern, North African, Refugee and Immigrant Health Equity session as well. So please join us for those as well.
Yes.
Next, please. Okay, I'd like to acknowledge my symposium co-leaders, Lisa Braddix, who is also one of tonight's chairs and chair of the organizing committee for the next 3 nights, who is the chair. She's the chair of our Checkup Steering Committee, as well as the Chief Health Equity Officer of the Southeastern Michigan Health Association, and Dr. Carrie Leach, who is another Wayne State University faculty member and Associate Director for Community Inclusion for Checkup. And I direct Checkup as well as our Office of Cancer Health Equity. Next slide. I also want to just acknowledge and thank our Checkup team, our small and mighty team. I'm going to go from right to left. I'm going to acknowledge and thank Ali Faki, a program assistant who I know is on the call today, Asha Freeman, who's our manager for training and capacity building, and Alex Sass, our manager of research and operations, who's just played a huge role in coordinating all our symposia and coordinating this evening's and this week's events. So thank you, thank you, thank you. Also want to give again a shout out to Chris Johns, who is not acknowledged here, but is helping us with all our Zoom and technology pieces as well. So again, this is the second of 3 programs. We can keep going. I want to just also acknowledge our planning committee. Again, Winona Bynum, Rhonda Day, Dr. Rhonda Dailey, Lisa Say, Jason Carbone, Donna Coulter, Angelique Outlaw, Lisa Rutledge, YL Soccer, Cheryl Thompson Marsh, and Lauren Hamill. And I also want to thank our symposium partners, the Faith-Based Genetic Research Institute, Western Wayne Family Health Centers, Detroit Food Policy Council, as well as Wayne State School of Medicine, School of Social Work, and our graduate school. Thank you again for being our partners in this work. And again, if you're interested in continuing this work, this is what I will say. I know that we are going to hear some fantastic presentations tonight. There's going to be a lot of dialogue. This was designed to be very interactive. And the goal is to come away with, walk away from this evening, as well as tomorrow night and the night after that, to walk away with action steps, to walk away with priorities. Because we will be able, as a Center for Health Equity, to fund some of this work moving forward. So we really need your voice and need to hear your opinions about what we should be focusing on moving forward, because we will move this work forward. So again, if you're interested in participating in a work group after tonight, please contact Alex Sass at alexandrasass@wayne.edu. And this will repeat this throughout at other points during the evening.
So good evening, everyone. Again, my name is Lisa Braddix, and I have the honor and privilege of serving as the Checkup Steering Committee Chairman, but also as a co-leader and organizer for this symposium, for the Black Health and Racial Equity Symposium for Checkup. And I'm just so excited and happy to be here with you all this evening. We had a lot of time to plan and be thoughtful about the things that we're going to be discussing tonight and over the next 2 evenings. So it is our hope that you will really just be present, offer all of your great ideas and perspectives, not just tonight, but throughout this entire symposium. I am honored to serve on this planning committee with my co-chairs, Dr. Rhonda Dailey, who you will hear from later on in tonight's agenda, but then also Winona Bynum, who you're going to hear from on tomorrow's agenda. I would like to have her have the opportunity to say hello to you all at this time. So Winona, if you could come off mute and say hello to everyone.
Oh, yes, thank you. So happy to say hello to everyone. Happy to have everyone here. Thank you for spending your evening with us. We are excited if you are here for all 3 nights. That's wonderful. If you're here for 1 night, whatever time you're able to share with us. And it's been said already, but just really, this is about sharing. So tonight we'll focus on structural racism and implicit bias and health outcomes, but each night we're focusing on a different area. To be clear, we could have done this all month and had topics all month, but these are our 3 that we're focusing in on. And thank you so much for bringing your ears, your heart, your ideas.
So again, this is just an opportunity for us to start the work. It does not end here. So I encourage everyone, if something really, really sparks your passion and interest, to really just get connected with us, because we're not ending it here. This is not just a talk that we're going to have. This is going to be the foundation of work moving forward to really just build on the genius that is in the communities in the city of Detroit and beyond, and to do what's necessary to just bring the work forward and to improve health and make sure that everyone has what they need to be healthy. That's what this is all about. So I will end it there and give it over to Dr. Carrie Leach.
Thanks so much, Lisa. And thanks, Winona, for peeking in there and saying hi. We just want to make a note before we turn it over to the fabulous Dr. Opara. And that is, we have created a symposium, all 3 of these symposia, to be very, very interactive, right? The foundation of what we do at Checkup and what we're trying to do is create a process for dialogue, right? So that we can move research forward together that's based on community concerns and grounded in what the priorities are of everyone involved and not just the research community, right? And so the idea is for everyone to consider how to step up and step back. So if you're a person that tends to overshare and dominate conversations, we would just ask you to be reflective about who you are in a room. And if you're a person, if you're somebody that steps back, if you employ strategies like entering information into the chat or using our interactive whiteboards or Google Docs that we're going to use, we really want you to feel comfortable to participate and add to the dialogue, because that's how we end up with a better process with everyone participating, right? And so we would just encourage everybody to feel comfortable and safe, and that we have all gone through a process of sensitizing ourselves as moderators and facilitators to help people feel heard and to voice their opinions. So we hope you'll do that with us for the next 3 days and throughout our symposium. And now, with that being said, I am excited to turn it over to Ijeoma. Are you there, Ijeoma? Welcome, and I'll turn it over to you. Cheers to a great rest of the evening and symposium.